Hello, and welcome to another episode of the Heart Centered Therapist podcast. I'm your host, Sindee Gozansky, and I am so looking forward to bringing my guest today and our episode. This topic is so near and dear to my heart, to my practice, to my beliefs, and I can't wait for you to meet my guest, Jay Tobey. Let me tell you about Jay. Jay Tobey brings a unique blend of investment expertise and a passion for behavioral health to his work. With a background in syndicating investments across real estate, private equity, and private credit, Jay has cultivated strong relationships with key players in the investment world. Since 2019, he has owned and operated a 48-bed behavioral health facility in Ogden, offering him firsthand experience in the industry as both an investor and a business owner who employs therapists, medical personnel, and so many others. As the founder of North Star Recovery and Wellness, Jay is dedicated to expanding access to behavioral health services and fostering cohesion within the industry. By leveraging his financial expertise and network, Jay works to bridge the gap between capital and care, focusing on underserved populations. His mission goes beyond generating returns for investors. Jay is committed to creating meaningful social impact by improving access to vital health services and resources for communities in need. Welcome, Jay. I'm so excited you're here.
Hey, thank you. It's great to be here, Sydney.
Yes, thank you so much. You started by saying, oh, you're not the usual guest because you're not a clinician. And I say, even better, you bring so much to my audience of therapists that this is really going to be enlightening from another side in terms of creating something from the ground up, the investments that you've done to create this amazing recovery and wellness center. I just can't wait to hear more about how your journey started and what you're doing now.
Well, thank you. And really appreciate you being here. And I really look forward to the conversation we're going to have.
Yes, me too. As some of my listeners know, and I think it's important to share with you because you're talking about providing access to people who are often underserved. I run a group practice, group psychotherapy practice. We serve folks that have insurance. A lot of clinicians don't take insurance. I came up in the field working with primarily Medicaid clients and community mental health. It's always been near and dear to my heart. We serve them now through our internship program, so they get free care through my group. But this is a very complicated undertaking to work with Medicaid and insurance and people in recovery, people who are struggling with addiction and mental health issues. So, how did somebody who is involved in investments get into this?
That is a great question. And like you said, to preface this, it is a very complicated industry and people have very strong feelings. So I hope I tread lightly. And if I say anything that someone doesn't agree with, that I hope someone can reach out and I can learn more about the space. But first started my investing career in call it 2018, 2019 in the behavioral space. I invested in a drug rehab, like you mentioned, up in Ogden, northern Utah is where I'm from. And I really went into that saying, I'm going to have my first investment ever be philanthropic to that point. I have no personal connection to this space. Personally, I've known some people that have had substance abuse in their lives and some mental health challenges, but no one in my immediate family. And I really wanted to give back philanthropically. Even though it was a for-profit facility, it was helping the most underserved population, mainly Medicaid. There was a few commercial insurance clients in there. And I just said, wow, what an amazing group of individuals that are pretty underserved in this space. And it's really tough to do it. Obviously, we found out that it's a very hard population. They're dealing with a lot of uphill challenges. And it's very, very complicated to work with those type of insurances. And
Absolutely.
so I can see why a lot of people don't. I can see why that there's not a lot of resources in that sector. after going through it. There is a lot of easier ways to help with, I mean, unfortunately, as you know, the statistics on mental health, substance abuse are going in the wrong direction. And so there is a lot of ways that someone can help in this industry, and there's a lot of ways that are a bit easier than the way that we went about it at first. And
Mm.
so, like you mentioned, my background was the financial world, the investment world, classic multifamily investing, some other private equity. But this space always kept drawing me back. We opened right before COVID, which was a really hard time to open a facility that it just by the population and the reimbursements you were getting needed a high amount of people, beds. And that was really one of the only ways that it financially made sense is if you had a high census. And so that was a really tough time to open is right before COVID, which is not a great time for a lot of people to be in a single, in a confined space together. And
Exactly.
so there are some challenges there. And so I helped the management team I was on the board of directors, and I just kept seeing it was amazing the taking someone and giving them just a little bit of hope. And you can really find a lot of places that generate a return, but I couldn't find one that meant more to someone.
Oh my
As
gosh.
you take
That's
someone,
so beautiful.
like, thank you.
Yeah.
So that's a
That the
little bit of my
return
story.
is the return is more than financial. Like you felt something. It was, I mean, on your heart to be part of this and saw the impact it had on people's lives and then probably the community too if somebody starts to live differently in recovery.
Yes, and that was the hope. And what I kept seeing is that there was more that we could do. Call it the private sector, because I'm a big history buff and we can get into the history of this space if you would like. But really, what I kept seeing is that people's options, they didn't have a lot of options to go to. And some of the other places that they had options to go to, government run facilities, I mean, they're doing great work, but they're oftentimes underfunded. There's a lot of issues with the current system, as you could imagine. And so I just kept seeing the need to really dive deeper into this space. And the overwhelming, I have thousands of stories, I feel like at this point, of people that have hit their head against this system or like physically could not check into a place because there's such you're limited by the amount of beds that you can offer.
Yes, exactly. And so many other resources. And yeah, it'd be great if you have a couple stories to share. We're a lot of our listeners are therapists who have worked with folks struggling with addiction, struggling with a affected family member. We've lost our dear clients to overdose and all of that. So this is such an important topic. And like you said, the problem is getting worse, not really getting better. The solutions seem a little bit more constricted. And so when you reached out to me as a guest, I'm like, oh, this is one of several conversations we're probably going to have, Jay, because it's just so vital to our field. And what you're doing with, I do not know where somebody could go who has Medicaid other than like maybe one place in my state. So this is very interesting of a
It,
model
and thank you. And you're up in
up in,
Maine. I was going to say
yeah.
Maine. And Sindee, really, the I love that your audience is made of the providers because that's what I saw is we were employing providers. And I'll be honest, there was a learning curve between, I would call it administration and or business and providers. But I really think that my heart goes out to the people in that are providing the care because I don't think enough spotlight has been shined on the people. If you're talking about first responders or people in the military, they are really recognized for what they do. But no one, and this is where North Star Recovery and Wellness would really like to help shine a spotlight on the people that are helping those people, which are the therapists. You have to hear some stories and deal with some stuff on they just give you your plate and then you're supposed to just go home.
See, you've been there and you're a great guest for this show because you're also living it. And this is also so important to me that we can all work as helpers in our community, in our world. And that's really what being heart-centered is about, opening our hearts to helping others. And I get it, like, you have this big, huge heart, and I would love to also talk about you employing therapists and what that's like, but that's a question for later. So, share a little about North Star, and also it's North Star Recovery
And well,
Care. Is that it?
oh, yes. Yes. Our website is northstarrecovery.care. Our Instagram is Find Your North Star, and
Mm,
you can look at us up on most of the socials.
amazing. Great.
And
Tell us
so,
about North Star.
yeah, North Star is really our mission is to provide a few things. One is a large geographical availability to more services. And so, how we're doing that is not reinventing the wheel. We are looking for good providers that would like to come in under our umbrella. And we want to really be data focused. We want to be outcomes focused because it's such a data rich environment. We can really start understanding, the the process of taking someone from the beginning to the end. And so North Star's entire goal is to build a world-class physical facilities continuum of care so that someone can check in, we can provide supportive housing, sober living, we can be with them. I would love to blend the vocational model and the traditional treatment model in that it's tough. I saw it. The traditional model is you've had an addiction for 10 years, you come in for 60 days, your your insurance won't pay for anymore. You're graduated, go to company number two. And that was really tough for me to watch and really learn. And it's amazing. It's an amazing work that those people do. But the issue is by the time someone gets 7 months into their recovery process, they might have worked with three different companies. And the whole time they're switching therapists. Are those companies communicating with each other? Are they with the same group of people that they're building a relationship with? That's one of the things that North Star is really trying to address is saying, no matter if you're in a different geographical location, you can still be under the same provider network.
Amazing. So, real continuum of care is what you're talking about, and including, which is what I love so much, being a rehabilitation counselor and a clinical counselor. When I saw that you offer job placement at North Star, job placement services, I was like, wow, this is it. Because you're combining quality of life and function of life for people once they get back into the world with their recovery. And so that's amazing. And so
And
few places provide that.
one of the things that we hope to do is in our outpatient program, I personally see this, is someone gets one of two things, I feel like, in let's call it the lower socioeconomic ge demographic.
Yeah.
And what we're really going after is let's call it middle class to and below. We're not
Mhm.
going after the Betty Ford Clinic or anything like that.
Because they can pay. They can go to Hazleton, they can go to all those places.
They have plenty of resources. There's been plenty of resources available, and they need help too. I don't mean to say that it's not, but that's not our main focus. Our main focus is those people that are running into the lack of availability of services or not being able to understand. It's very much like the healthcare system where you have to understand the ebb and flow. So that is one thing we would love to provide is that full continuum of needing those two things, which is sometimes supportive housing after. They either get a good place to live and no job, or they get a job and they have a hard time finding a place to live, maybe because of their past. And so we're trying to fix that and saying, again, coming from a financial standpoint, being a financial firm, is saying, how can we bring resources, whether they be state resources or whether they be investor resources, and saying, can we fix some of those problems? We have X amount of people within our own system, X amount of people run into needing housing. Not a problem. Let's go pour some resources into housing. Next issue is they need some sort of vocational training or job placement. Can we, as investors and in the business world, provide a next step for them? Can we provide some businesses that are within our portfolio that can support them? Because if they get a job that they wake up at 6 in the morning, 5 in the morning, and they work till 7 or 8, as therapists, they're going to have a hard time making it to or being incentivized to come to your session. And that's one of the most important parts is helping them go through the steps, but they're so tired, life starts hitting them. If we can hold their hands for as long as we possibly can and saying, and this is, we're not there yet. I will just say we're not there on the job side, but one of the overall goals is if we can have them in a place, either one of our portfolio companies working or a friendly company, and they need to go and meet with their therapist or go to a group, that it's okay. Take some time out of your day, go take care of that, and come back.
Wow. And talk about like supporting your employees' mental health. That's amazing. I mean, you're talking about doing this in sort of this dreamy way of providing the supportive care, but wouldn't it be great if more industries did that in general?
Yeah, it would be amazing. And it's a big, honestly, there's a lot to bite off, as you
Mhm.
know, within this industry. And so we're starting with the first part, which is, can we build the first front end part of the continuum of care
Yeah.
and really try to support them with a good aftercare program?
Hmm.
Because that's one of the issues I see as well is it's hard to incentivize a therapist, or there's not a lot of resources for aftercare. Does
Yeah.
insurance pay for that? Who's going to pay for that if it's a client that's struggling with not being able to do some private pay?
Yeah, absolutely. And there's a huge need for that. Or if therapists don't take their insurance or don't take Medicaid, then they really will struggle to find a person who does. And that again can be a resource thing, a barrier to treatment, ongoing treatment, and so on. We see it all the time, and just even in mental health. For sure. I have a question, being pretty naive about the investment world. So, as you talk about the networking you're doing and seeing a need for more funding, or you're getting some reimbursement from the state, whether it's Medicaid or from insurances, but then are you also, with your skills and talents, then creating ways to network with other people who are investors who might invest in this behavioral health industry and, your company?
Yes, correct. That's exactly what we're doing. Over the next 12 months, we're at least minimum investing 150 million into this sector. That's our, this is our main focus, is really coming in and helping the substance abuse and mental health sector.
Mhm. So you find investors. So this is where capital and care come together, and you're finding investors who have that service heart and desire to make a difference in the world and to improve people's lives. So it's not just like investing in a product per se, or a little of
Yes,
both.
a lot of both. Capital, care, there's impact investing. It's all, it's backed by real estate. So we're
Mhm.
investing in the operations of companies like your regular therapist outpatient services. And so those have their own expenses and upside, and you need to draw clients to your practice. Luckily, unfortunately, there is a lot of demand, pent-up demand that people are looking to try to find, especially quality of care. And so yeah, our entire job is to bring more resources, more investors, more light to this sector and say, look, we need to pour a lot of resources into, um, I liked what you said, the capital and the care side coming together and saying,
Mhm.
and really trying to say, we don't know how to fix this. Let's call it as investors or as in the financial sector. How can we work with the therapists that are doing this day to day? And I don't think we're going to find a silver bullet or anything like that to say this modality is the way we should just pour everything into it. One of the hopes that we can do is find great modalities and great therapists and great groups that have different ways of handling this situation, bringing them together so that if, as we get clients coming in, we can almost like triage them and say, oh,
Mhm.
you would fit best statistically over this path. If you can go to this facility and you can have this sort of experience and work with this type of therapist and they're doing this type of modality, we've seen a really positive outcome that we can start to track. And that'll take years on the continuum of tracking those outcomes. But if they're struggling with that one facility, guess what? We have one or two others that might have a different approach, different modalities. Maybe they're more heavily into the medical aspect of it. And let's try to have that client find success there so that
Mhm.
we're helping them go through the system rather than having while you're trying to fix yourself, you're also trying to self-advocate and find out and navigate. Let us try to help you. We're trying to build the guardrails and the system so that you can navigate within that system and we can help them.
That's fabulous. People often think they have a misunderstanding and would think, oh, all people who have addictions could be treated the same way. And you know what? Actually, even more so, one size does not fit all. People with addictions tend to be so diverse and have so many different needs. And so the quality of care that you're looking at offering by many different treatment options is amazing. Like, that's something that I think we as mental health professionals would really embrace. And we need to do that more. We need to see people where they are. And then one of my mentors says where they want to be, right? We're meeting them where they are and then at their hopes and dreams, which is what, Jay, you're doing with the job placement and the sober living and supported living and ongoing treatment. That is so cool.
Yeah, and how I look at it is whether you like them, positive, negative opinion of the medical industry, they've done a good job at finding specialties.
Mhm.
And I look within some of our facilities that, we have a client that's more a mental health client sitting next to more a substance abuse client. They're not really specialized. They're getting the same treatment. One thing I would love to do is start specializing different branches within this, and really backing those resources. So it's like, hey, if you've got a knee injury, you're not going to the same person that's dealing with shoulders all day. You're going to the
Right.
knee injury place. Again, I think
Mhm.
there's some theories here on why we're pouring so many resources into this space. My theory is that it's an under availability of resources to be able to specialize. We're putting a lot of different types of people dealing with a lot of different types of recovery in the same area, in the same facilities or in the same groups because there's not an availability of, can someone get in? If you want to
Yeah.
talk about a story, there's a person I know who one of their family members tried to commit suicide. It took them
Mm.
3 months to try to get into just the hospital system
Oh my
because
gosh.
of the lack of beds. And so if a bed popped up, they were taking it, whether or not they understood really what that entailed.
Yeah. That's so sad. And it's an example of life or death. And it's not what anybody would want for their family member. Yeah.
Yeah. So there's a lot. And one of the things too is we'd love to engage more with the therapeutic community. Honestly, reach out, find me on LinkedIn, and I would love to hear what the therapeutic community has to say about this approach and ways that we are not a bull in a china shop, but that we can work with those that have been doing this for a long time.
Exactly. One of the things that I think could be really interesting to talk about is with your investment expertise. And so many therapists, we don't get the business training. We don't get that side of things. We're not required to take very much of that in our graduate programs, unfortunately. So it can be very limiting. And if you look at a lot of therapists who are, in solo practices, or maybe they're starting group practices or even small community agencies. And I've known people who've done all of those things. How could they start to look at bringing on an investor or working with an investor?
Yeah, that's a great question. And so, what I would tell you is they would want to look at, I get this question a lot actually, because we raise a lot of capital and we work with a lot in my history. I've worked with a lot of different industries. And so people ask me how they engage with an investor. The biggest thing I would say is to organize your proposal to them. What am I bringing to the market? Am I trying to fix? Is there a problem to fix? Or is it an expansion play? Or is it just a supportive play? Hey, I can see this amount of people. My time is billed hourly. If you are able to invest in our practice, I'm able to bring on two, two more therapists, or at least some help. Maybe they're not licensed. Maybe they're different licensed but working through that proposal to say, it just comes down to what are they trying to accomplish within their business? And
Yeah.
how can bringing on capital help increase the speed or increase the capacity? Those are some of the things bringing on capital does. Bringing on an investor can do is it can increase the speed. You're going to naturally grow. Maybe you're at one solo practice and you want to try to build a into two practices. You could probably do that over 5 years.
Hmm.
Giving up a little bit of the ownership, can you increase that? And then by year 3, you can have, instead of just two practices, 3 or 4 practices. So those are some ways that I feel like you could engage with an investor is to get your picture clear, what you're trying to accomplish within your business, and
Right.
then craft your proposal. And I could get into, there's a lot of different ways to engage an investor. They could be debt, they could come on as an equity partner. Being very frank, having an equity partner, it's a marriage. So you've got to be okay with someone who, if they own 25% of your practice, they're probably going to want to understand your practice. And if you don't want someone telling you what to do, or not telling you what to do, but
Yeah.
being involved and having opinions about how things are being run, it might not be the best. There might be some, let's call it small business administration, like SBA loans that
Right.
you can look at. There's a lot of resources out there. Um, I hope that
Yeah.
helps answer your question.
Jay, it's so great. It's amazing information. I love how you simplified it for us because that's really helpful. And I know it's going to spark the interest of some people. Maybe that would be also a topic to come back and talk about because this is something that, again, would expand the reach of mental health, behavioral health services.
And
Okay.
and there's what I would say to those people is there's always people looking to place capital. And
Hmm.
that's what we are finding is that most people just don't know how to engage with this sector. They know it's a huge issue. They would love to do something with it. Most people have some impact money that they would like to go and get a good return on, but also help something that's so prevalent. They just don't have a good, safe investment. The three things, if you're going to look at investor capital, that they are looking for is how is my money secured? What is the timeline of the return of that money? And what is the mechanism of that money coming back to me? So if you just want to take those three,
Mm-hmm.
how is my money secured? Again, we're investing in the physical facilities. We have 60% of our portfolio is the building,
The building and the real estate.
building and the real estate. We're securing it there. How's my money returned? Is it cash flow? Is it a sell in 5 years? What is your exit strategy? Are you going to, if you grow to two, are you going to then go get a bank loan and pay back your investor and get the equity back at a higher rate? And what is the timeline of that mechanism? And just so you know, sometimes if it's totally okay to, if they're just investing in a practice and it's unsecured, just know they might want a little bit more.
Hmm.
They might look at it as you have two levers, you have risk and you have reward. And so if they're taking a little bit more risk because it's unsecured, it's in your business, they're believing in you, they might need a little bit more reward, a little bit more upside.
Yeah. Yeah. Good point. That's so interesting. Are there trends you're seeing in the investment world toward behavioral health industry?
Yes. Yeah. I think the industry is one that everyone would like to get to.
Hmm.
It's, I think, a really hard industry, and that's why there hasn't been as much movement as we've seen in other industries, is because it's so labor intensive. You have to employ a lot of people,
Oh my
and
gosh.
you have to do a lot of, as you know, medical billing. If you're dealing with insurance, you have to do a lot of staff. There's high liability. But what I would say is if you've seen what's happened in the talk therapy space with BetterHelp, whether you like them or not, or there's been a lot of private equity that have been approaching, again, people that would like to, they're in solo practices or smaller practices, and they're bringing them in under larger group umbrellas. I think it's starting to happen more and
Mm.
more in the talk therapy space. We look at ourselves as a more of a first mover in the inpatient, outpatient, sober living space. There are people that have definitely been in that space for a while in groups, um, but I would say it's happening more and more as this sector professionalizes and institutionalizes.
Yes. Wow. I mean, that's so refreshing to hear though that there's these trends happening to expand behavioral health. It's really something we don't hear too often. So I think this is really going to pique people's interests. You said something before we were meeting or in our connection about bringing representation to smaller facilities, to state governments and insurance. And I don't really know what that means, but I want to understand it.
Yes, so what that means is we're in the process of basically helping other facilities kind of group together and working with some really good facilities that have been at this for a long time, that they've been so head down in their practice and their providing services, that we are coming and saying, look, the government wants to understand and work with this sector. They have lots of resources for the sector. Sometimes if you own 1 to 2 facilities, it's really difficult for you to spend time at Capitol Hill or working with your local representative. So what we're trying to do is, again, North Star Recovery and Wellness is all about bringing resources, that capital and or state resources, to bear in this sector, and really try to group together and kind of build almost like an association. Would be the hope, is to
Oh,
say locally, build an association where we can have good representation, where we can work together. North Star might not invest in every facility that is working with us, but together we can be stronger. And are there policies that are actually hindering recovery? And can we work with lawmakers to help those policies? When were those policies made and by who? And most of these facilities are probably running into the same issues. That's what we're finding. There's a handful of bad policies that are hindering long-term recovery. It's not hard. Let's go work with some lawmakers. You guys keep providing what you're providing, and we'll take on that responsibility and go work with them. Because in the
mhm.
financial space, that's our entire job, is wining and dining a lot of the mover and shakers. So let us
Yeah.
help those people help the industry.
Yeah. That's great. Let's hope that's your 5 or 10 year plan tops that should happen in that amount of time. It's amazing.
Yeah, and we're really trying, like right now, we're also trying to do some initiatives. We're also doing, not even just trying, we're also doing initiatives, public good initiatives.
Mm.
Because I think that's where care and capital also come together. Is we just did a local clothing drive that was statewide for Utah. We've had a
Yeah.
huge outpouring, and I think it's just become, local news picked it up, almost all the major local news, because they were going to donate clothes somewhere. And what we saw is a lot of these facilities that are working with, let's call them Medicaid clients, they're housing them, they're feeding them, the clothing, state hospitals. There's a ton of need that isn't always spotlighted, to say these people need clothes just as much as anyone. So we're giving them more. Again, it's about bringing resources. So here's
Right.
some bags of clothes that you guys don't have to go buy or acquire. And when a client comes in with needing a shirt to go to an interview, they might not have owned a shirt for 10 years. Here you go. Or like a button-up shirt.
Yes, exactly. That's amazing. Statewide clothing drive with North Star behind it all. That's so cool.
Yeah. And again, we hoped to just show the industry that we're here. We're here for you. We're here to help, and would love to engage in any way we possibly can, whether it be on the care side, whether it be clothing drives, or we have a bunch of, each quarter, we have a bunch of initiatives, big public good initiatives, that the private sector can shepherd a lot of attention and spotlight to this industry.
That's awesome. And the public good that you guys are focused on that. And I think that's what our communities and our country needs so much of right now. And just being able to give people back their dignity, their hope. You're bringing so much to the people you serve and also the people that you employ because they're part of this.
They are. They're the day to day. They're really what's making the sausage. How the sausage gets made, it's by the people doing the amazing work day to day.
Yeah.
And how can we help best support those that are trying to do
Right.
amazing work?
Right. And that's always a question. Like, how else can the industry better support mental health professionals? What do you see? Or maybe there's some kind of initiative North Star has done.
Yeah, that's a great question. That's one that we have been thinking about. And it's making the quality of life, if we can make the quality of life of providers better, one thing we see a lot of is a lot of turnover.
Mhm.
There seems to be a lot of turnover within the staff, and it's because it's kind of a hard demographic to work with. But one thing we would like to do is just make it more fulfilling for the staff. Is there more? That's something we're actively thinking about, is making the life of the providers better.
Exactly. And
Whether,
we don't always know what that is. And I'm interested in that. Jay and your company are interested in that. If anybody's listening and some experience made your life as a provider better in your workplace, reach out to him on LinkedIn or message me and let's bring this conversation more into practicality.
because exactly what we are working on, is bringing the good of the industry and and saying we don't have all the answers. If you've seen something that's really good, share it with us. Let us know because we want to put it into practice.
Yeah. Yeah. That's awesome. Is there We could keep talking, but I really want to respect your time. And before we wrap up, your model of North Star is just amazing. It's exciting for me to hear as a therapist, as a provider, as somebody who would want to, if I were in Utah, to send a client there. And it's just this amazing model with so much behind it, from the investment part to the initiatives. How can somebody who's interested in elevating their game, what would you say if they want to just take some pages from what you've created? What's a message, like a parting message you'd want to give somebody who's like, How did he create this and what can I do in my little world?"
Yeah. What I would say to that is that you can do it, is that there are so many people that need help, that any little thing that you can do in the substance abuse or mental health will go a long way. So I would tell them to just, whatever they're thinking about doing, is just go start it, is just go try to execute on it. If you have some idea or initiative of your own, most likely the community, if reach out to others, they probably want to do it as well. And that's what we've seen, is there's been a lot of support. Just someone needs to lead the way and say, hey guys, we want to do, ours was a clothing drive to start out. And there was great support with that. We just had to rally others together. And so that's what I would impart, is that you can
Wow.
make a huge difference on people's lives in this space. And
Wow. Thank you so much for that, Jay. That's so inspiring and encouraging. And I really want to acknowledge you for the tremendous work you're doing in our field as somebody who came to behavioral health from another direction, but clearly it's on your heart. It's a heart centered passion of yours that you're really making a huge difference in people's lives and in your state and hopefully across other states. I know so many people are going to want to know how they can find out more from you and about you.
we're
Yeah,
working in multiple states right now. We're
you
working
are?
with a group. We're talking with a group in Maine. We're
No
talking with a
way.
group in Florida. We're talking with groups all over the country.
Oh my
This is not
gosh.
just Western United States.
Okay. I thought it was. That's so awesome. I can't wait to hear more about it. But so tell everyone about North Star Recovery and Wellness. How can they contact you? How can they learn more about all of these things?
Yep. Reach out if you're a community leader, if you're an investor, if you're someone just wanting to engage in uh, our services or find out more about us. Reach out on northstarrecovery.care is the website. There should be a form to fill out. Email support at northstarfingroup.com. Reach out to me on Instagram,
Ah,
or find your North Star on Instagram or LinkedIn. Just reach out and we would love to engage more with the community. We've got a long way to go. Some of the things we talked about today were theoretical things that are on our roadmap. Some things we're actually executing on, but there's so much work to be done, and we look forward to really just trying to help support this industry. So
ah,
thank you for all the work that you guys do. You are a practicing therapist, so
mm.
kudos. You guys are helping a lot of people.
Wow. Thank you so much, Jay. And for people just listening, he's been smiling so much while he says all of these things. And it's just amazing to meet somebody who cares so much about the work and helping people. So refreshing. And you got a great handle on Instagram. Find your North Star.
Yeah, thank you.
So awesome.
This
We
will be
will link everything in the show notes too.
one of many conversations we hopefully have.
Absolutely. Thank you so much again, Jay. And till next week, everyone, stay heart centered.